Hi, everybody. It's Lab Friday, and today we're going to talk about estrogen. There is many different types of estrogen that are produced by both men and women. But the main one we're going to talk about today is estradiol. It's the main metabolite that most men and women use. And so that's what we're going to talk about. So let's get into it. So estrogen in men kind of gets a bad rap. A lot of providers and patients think that high estrogen based upon just a simple serum level is going to cause problems like gynecomastia, acne, weight gain, nipple tenderness, all these things that just simply aren't true and probably due to just hormonal fluctuations and will subside if given enough time and let your hormones just kind of regulate and become normalized. So we don't ever want to block or really even worry too much about estrogen. We want estrogen, men to have high estrogen levels and so that they have the cardiovascular health and they have the vascular protectiveness and the neurocognitive protectiveness for the prevention of dementia and Alzheimer's. And believe it or not, we need estrogen for erectile quality. So I don't really test estrogen in men anymore. I just kind of, if there's symptoms or something associated with it, depends on the symptom, what's going on. You can always increase the frequency of dosing, or you can just kind of wait to see if it subsides. But a serum estrogen really doesn't really tell me what's really going on with your estradiol in men. So I don't look at it anymore. So don't worry too much about your estrogen in men and just kind of go on about your day, and any symptoms you have will eventually subside. So estrogen or estradiol plays a much bigger role in women's secondary sex characteristics and sexual reproductive health than it does in men. However, similar to men, it has the same benefits associated with it systemically. Prevention of neurological problems, of Alzheimer's, dementia, prevention of osteoporosis, osteopenia, prevention of cardiovascular events like heart attacks and strokes. So we're very similar in that way. At least the difference is with women, it plays a large role in their sexual and reproductive health and it's the creation of secondary sex characteristics. So when treating with estrogen or estradiol, we really want to know if the woman's in pre-menopause, perimenopause, or actually in menopause. We're typically not going to treat pre and perimenopausal women because we don't want to have this elevated estradiol where it's going to have a suppressive effect on progesterone and create this hormonal imbalance, which is just not good. We're really only going to treat women that are in menopause. Essentially, their ovaries are just not producing any more estrogen. We want to make sure they have estrogen, for all the positive benefits that we listed earlier, and also breast cancer reduction. So when we look at labs and when we're treating a woman with estrogens, we want to kind of have a lab range between 75, 80, and 100. Those are the numbers that we're kind of shooting for, and will kind of tell us what our dosing is going to be associated. So when treated with estrogen or estradiol, make sure your provider thoroughly understands when and how to use it. Especially in women, we don't want to give it too early to create a type of hormonal fluctuations or imbalances that could negatively affect you. As for men, I really wouldn't worry too much about your estrogen. A higher estrogen is okay. It's good for you. It helps protect you against dementia, Alzheimer's, osteoporosis, cardiovascular problems, erectile problems. So we need estrogen. And if you work with a provider that wants to give you an anastrozole or block your estrogen based upon a lab number, I would look for a different provider. Just don't take the anastrozole. You don't want to block your estrogen. So any questions, leave them in the comments and have a great weekend.